Listener discretion is advised.
The opinions expressed on this podcast are those of the individuals, and they do not reflect any official view of the United Steelworkers, USW Local 105, or its officers or sub-board members for officers.
Now, from the banks of the mighty Mississippi, this is Steel Revolution.
All right, hello podcast listeners. Welcome to Steel Revolution 86.
A6.
The holiday end of the year podcast. A big show, which we usually try to get big guests at. Thanks to Mike for landing a big guest this time.
We got it.
So I'm Roy Hutt,
Mike Nicholas.
Brad Grieve.
Sean Geisens.
and we're here to give information out to not only our membership but others in our labor community. And start things off first by Mike. You give us an update on the Nathaniel Payne scholarships.
So we're going to draw for the scholarship on Tuesday. We normally would do it at our business meetings, but since they are canceled this month, we're going to do it over Zoom. So I believe we have 40 applicants this year. We're giving away 10 scholarships, 5 from us, 5 from Eccentric Credit Union. We're going to do it, I believe, afternoon time, 2 or 3 o'clock on Tuesday. So there's still time to call. You can call Terry at the hall, let him know you want an invitation to the Zoom meeting, or just leave a message for me and I can call you back. But we will be doing that on Tuesday. And again, we're drawing for 10 scholarships.
All right, and Brad, Christmas baskets.
All right, we wrapped up our collection. I guess we have a few hanging out there that people want to donate yet. We will get that collected. Bottom line is we have enough money now to do the 600 baskets. That was our target goal. And this year is going to be different. The committee and the lead team from the plant will be packing the baskets. But Friday will be normal. So the basket pickup will be Friday, December 18th, 5 a.m. to 6:30 p.m. Employees who you should have got a letter back if you turned in for a basket. And then when you're picking up the basket, make sure you have that letter with you. And we'll be in the northwest parking lot behind the Learning Center. Stay in your vehicle. Give us the letters. We'll load the baskets, and you'll be on your way. It's usually pretty quick operation. So thanks again for your help in making this a joyous holiday for families in need. Any questions, give me a call here at the hall or myself, 563-343-1798. Thanks.
You were reading that, you almost said call Brad Grieve. You were
I wouldn't
close.
do that.
I was
You
waiting
were
for
close.
it. I was waiting for it.
I almost caught it. We'd mentioned some grievances that we have had and wanted to give an update on that. We are still waiting for an answer for our grievance on the employment security language. But we did receive an answer on a grievance that we filed regarding short-term disability and the pay from that, or the pay from that, from having a COVID test prior to surgery. The Hartford will cover the day of the test and the quarantine that follows as long as it is required for the surgery. Tests are done within 5 days of your confinement to the hospital. Tests are not repeated once you are confined. You are not confined prior to the day of surgery, and you do not report to work on the day the testing is performed. If you've had a COVID test prior to surgery and the test and the quarantine was not covered, you need to call the Hartford and request a review for underpayment due to pre-op COVID test. After that, if you need any help, please call the hall. A few things to go over here since we are at the end of the year. Any unused vacation will be paid out to you on today's check. If you are out on short-term disability, it will be next week, the 18th. You may still use those days for time off, or you can still work the floating holidays after they are paid out to you due to the end of the year payout. What's that, Brian?
Just, I don't know, Roy already covered this, but all meetings in December are canceled. That includes board committeemen and all business meetings, local 105.1, 105.2, and 105.3.
Hike. Sorry.
No, Mike mentioned that the meetings was canceled, but he didn't go through all of it.
It's
so-
okay, Brad. Thank you. I appreciate it.
So that's why you're here, Brad. A list of those members that had perfect meeting attendance. Your name is listed in the Forerunner. Those members will be receiving a $50 credit towards merchandise here at the hall. We do have new hoodies and t-shirts along with more t-shirts on the way. So whenever you see that, come down to the hall, get your merchandise. Again, more stuff at the end of the year. Reminder, you can carry over 8 ETOs or 4 SPLs into the next year.
Or, you mean and.
And, yeah,
Okay. We'll make sure it's clear. You said or.
okay, it's and.
Okay, thank you.
It's right here, it says and.
Well,
This
yeah,
is-
but you
this is gonna
mentioned,
be tough.
you said or.
Thanks, Sean.
Just making sure it's clarified. And you're welcome.
It's gonna be a long day.
See what happens when you pick on me?
Yeah, your
Tech
your
guy.
buddy,
Your buddy
your buddy
backs you up.
backs you up. Yep.
Yeah.
Sean to the rescue.
I'd be scared if I were you, Brad.
8 ETOs and 4 SPLs may be carried over into the next year. Anything over that amount will be forfeited. Along with that, up to $500 may be carried over into your health care flexible spending account from this year to next. Anything over $500 in your flexible spending will be forfeited at the end of the year. I put a bunch of money on braces. That's
Yeah.
what I did with it.
I know that.
Okay, you said healthcare. What about dependent care? Do you know?
There are different rules for dependent care.
I didn't see that one.
Yeah, there are
Yeah, I
different
didn't
rules.
have that on there.
I thank you. I'll look into that then.
Maybe we'll come back at the end of the show and we'll have that. I'll see if I can find it.
Thank you, Roy.
Or you can remind me later, Sean.
I'll do my best.
All right, moving on to COVID. Broken record here from last podcast. COVID cases in the community continue to rise. We still have masks and gaiters down here at the hall for sale. Oh, extra of the first mask that the company hand out. I did still see some at Center Gate. You can always get a extra paper mask. Try to get one at screening or at Center Gate if you forget yours. As of right now, at least, I believe I'm up to date. 277 confirmed cases at the plant, or people from the plant have been positive. If you are sick, stay home, call medical. If you feel you still need to stay home and you have other symptoms that maybe not on the medical's list to keep you away from work, like loss of taste or smell, if you have a few of the other side effects or of COVID, headache, upset stomach, stuff like that, and you still feel you need to stay home, your doctor can always put you out. So that is an option for you to stay away from the plant and to keep your coworkers safe and healthy. If you cannot be 6 feet away from somebody on the floor, you must wear a mask. This does include the break areas. I thought it was a little, maybe people were confused with the break areas because you're in there, you're eating and drinking. So maybe it was okay to not wear a mask. No, you should still be 6 feet away inside the break rooms. So the rules at the plant are that you have to wear a mask from the gate to the red PPE line, and then any other time you have to wear a mask is when you are closer than 6 feet away from somebody. It doesn't matter where you are. So please keep that in mind. We're worried, and I'm worried about a few places in the plant on whether or not you got adequate break areas, that there's enough break area space, and that you can get 6 feet away. If you have a concern with that, get a hold of your coaches, get a hold of your union reps in your area. Go along with the COVID spread around here, there's a article statement that ASME Council 61 President Danny Homan had put out here. I believe this came from last week about the spread in the corrections, jails, and prisons. So you look at some of their numbers, and 1-day turnarounds. 74 inmates tested positive for COVID, an increase from 11 in a short amount of time. It's staggering the amount of the spread in these places, and one staff member and 10 inmates has died in those facilities. So it's he's asking to have jails and that not be transferring inmates from the jails to the prisons. Believes that will slow the spread down. State of Iowa does not want to comply with his recommendations, but just to show you, that meatpacking plants, how fast this thing can spread and take people out and workplaces out.
Yep.
All right, with some more joyous news, we won't be back on before New Year's,
Aw.
and so
Sorry.
going into the holiday season, going into New Year's, you might be thinking about, hey, what union places or what companies have their products made by union labor?
I feel that way every time I leave this podcast.
Like having something?
Yes, actually, yeah.
Oh, Sean.
So do tell, what places,
Oh.
what companies?
Well, if you're like Brad and you like Budweiser, Anheuser-Busch, there's a bunch of beers on here I've never heard of. Black Eye Ale, Black Hawk Stout, Blue Heron Pale Ale, Boxer. Oh, there's Brad's Budweiser. Bush Latte for here in Iowa. Butt Creek Organic Collection, never heard of that.
Should have started Butte.
Butte.
Come on, Roder.
We know
Hey.
we know what he's thinking about.
I'm trying to make this podcast funny again.
Well, that's why I'm here.
We must make this podcast funny again.
Screwed.
Anyway, I don't think I need to list all of it. I will try to find the links and that and post it on the locals Facebook page or our Facebook page, along with any of the other stuff the AFL-CIO puts out.
But you did forget the Old English. The
Old
OE.
English?
Yeah, that's on here.
Well, there's other. Red Dog. Red Dog was a favorite when I was in high school. Not that I drank when I was in high school.
Of course not.
Never. No.
Min House, Oktoberfest. You can get Min House at
Ooh, Land Shark.
Hy-Vee.
That's good.
You got to be
Thirsty.
careful. You got to be careful what Min House you get, though. Some of it's not very good. Wines. Favorite of yours, Sean. Boone's Farm and Mad Dog 2020.
That's good. Little MD 2020. We're good.
Yep, tequila. I haven't heard of all of these. Azteca, Captain Gold. Other ones I don't want to
Other
say
ones you
because
could
you'll make fun of me. Vodka. Oh man, I don't. None of these look familiar to me.
No.
Pinnacle.
We'll get the links and put them up.
Yeah. Other than that, one that USW does make Captain Morgan.
Yep.
So. So, will we take a break? We'll come back with the interview, and then we will close out the show with a new holiday tradition of Mike's Recipe Corner. And we'll talk about maybe some holiday recipes.
We'll be
Boy,
back.
I can't wait.
Okay, so joining us on the podcast today is Steve Salmon. He is the Assistant Director of the United Steelworkers Health and Safety and Environment Department. Thanks for joining us, Steve.
You're welcome. Thanks for having me.
Great. We like to start each interview by getting to know our guests, so can you tell us how you got your start with the Steelworkers and how you ended up where you are now?
Sure. Well, it actually started with the United Rubber Workers, who ultimately merged with the United Steelworkers of America to form the United Steelworkers. And I went to work at the Bridgestone Firestone plant in Des Moines, Iowa. Spent 13 years there. Worked on the line and seen people getting injured and things of that nature. Took an interest into safety, and I had spoke up about some things. Participated in a safety subcommittee, and then ultimately was asked by the local union president to be a full-time health and safety representative for our local union, Local 310 in Des Moines. And out of the 13 years that I was at that plant, 8 years, I was the full-time health and safety representative, where two of my union brothers were involved in a Banbury flash fire and had a 10 and 20% chance to live. And there was a lot of things that came out of that that ultimately changed how things went, and stood up for health and safety and was fired, suspended for my health and safety related activities. And that led to working a lot with Iowa OSHA, who I ultimately ended up getting a job working for the state of Iowa for almost 5 years. And then the steelworkers called me and said, hey, we still know you. We think your experiences and working for the state would be great to work for us. And so I ended up going to work for the steelworkers in 2004, and something special that maybe the local union members might like knowing. My very first place that I went to as one of the staff of the United Steelworkers Health, Safety, Environment Department was your union hall. In fact, I had a U-Haul behind my truck, and I stopped to deal with a green card issue that involved an overhead crane. So that's where we've been, and since then, of working in Pittsburgh out of the headquarters, I've been with the Alcoa bargaining, and we helped through the power of that bargaining committee of you all get master language for health and safety, and that was a really big win. So it's always a pleasure working with all of you.
Well, great. Thanks, Steve. So the main reason for our interview, as I'm sure you know, is the effect of the pandemic on our workplaces and our members. The Steelworkers website has some really good resources, as we've been looking this week, for our members to use, not just at work, but as home as well. We'll give the link later in the show. Steve, in manufacturing settings such as ours, what are the main things you recommend our members do on their own, and some things that our local as a whole should be doing to keep the brothers and sisters of the union safe at work?
Sure. Well, let's take the first part of that question about what can you do on your own, and then what can the local do as a whole. I would just say that first, as a person on your own, I can't emphasize enough about using control devices. And everybody's going to say, what's a control device? And that is the device that you wear on your face. And that is really one of the most important things that you as an individual can do, is protect yourself, protect others, to the best that these things can provide. There's certainly not a filtering face piece respirator, but it is a control device, and this is an airborne virus that lots of times gets overlooked about being airborne. So wear them, and wear them properly. And then the next part is the frequent hand washing, sanitizing, those things, keeping some physical distance. Those are all things that we can do on our own, but we can't always be successful in that if the design and the way things are that, we can't use those types of controls. So then that kind of takes us to the next part of this question, which is what can we do as a union? And the first thing that we would want to do is apply the hierarchy of controls. And the hierarchy of controls is any time that we have a hazard in a workplace, if we have something that causes cancer and we, clean parts with this solvent, we want it gone. We don't want to be cleaning parts with solvent that can cause cancer. So the first thing we want to do is eliminate it. And then the last thing that you want to do is hang a bunch of personal protective equipment on us where, our gloves, where we can't have good dexterity, we have respirators on us, it's hard to breathe, there's all these things that's going on. So you have what's most effective to least effective, but where we do have the least effective controls, we do want the best that money can buy. So, if you are dealing with that hazard, then you want to have all of the best that personal protective equipment can be made. And now, how do we apply that in terms of dealing with COVID? And here's kind of how this would break down. So in the hierarchy of controls, what we can do as a union is push these types of controls, and what's most effective down to least effective, as I said. So let's take elimination. not all of us can work from home. But are there ways that to help reduce the load on the workforce of who can be symptomatic or asymptomatic or shed the virus? Can we get people to work from home, regardless of what your pay is, if you're salary or hourly? Is there ways that we can eliminate exposure to one another, since not everybody's going to show symptoms? So if we can get people to taking some of that load out of the workplace, then it's wise to have people work from home where possible. And secondly, I would say in the elimination part, where people are symptomatic or workers who have tested positive, we don't want them in the workforce. So we want to eliminate that exposure where there is symptoms or where somebody can test positive. So that's the first piece. Let's look at the second piece, the substitution. Obviously, there's things that we can do to kill the virus on frequently touched surfaces. So door handles and so on, controls, steering wheels, forklifts that would maybe be shared with from one person to another. But instead of using chemicals that would cause like asthma, could we find or substitute a safer chemical or method for cleaning? And so that's important. Are we cleaning, disinfecting with things that would be essentially green and helpful in killing the virus, but yet still be friendly to the workers? So the other part of substitution is, can we use technology to work remotely? So, for instance, we're using a phone today, and we could have done this in person, but instead we're using technology to eliminate some of that exposure. So we find a substitute. If we can't meet in person to do a podcast, let's do it remotely and use technology. Then let's go to the third one, engineering controls. These measures keep the hazard from coming in, and that's contact with workers, such as increased ventilation and filters that can help filter out, such as the MERV rating, and the maintenance of that ventilation system. And then properly sized and placed plexiglass shields. I want to say there's some good and bad that goes with that. The good is that it does stop droplets. So if somebody would sneeze or cough, that the droplets do have a bit of a barrier, but the aerosols are still going to travel through the air. So even though we have that engineering control, be mindful that they're not 100% of stopping a virus from floating through the air. And then properly, just doing things like no-touch time clocks. We've seen a lot of that where sometimes people now are using texting to their supervisor to clock in and out to stop kind of the congregation or the areas where people would congregate, and it would be kind of a trapped area and people would be closer to one another. So is there other ways to clock in and out? And other things is no touch, like bathrooms, your sinks, your paper towel dispensers and such. We've also seen people using headsets now, so they look like helicopter pilots, and instead of people using phones in a plant, they're now communicating through headsets looking like a helicopter pilot. And I would just say that we don't share those. We don't share a toothbrush, so we shouldn't be sharing headsets. So we've got to be thinking about, when we put those engineering controls in place, what other things that could come with that. And then the next item is administrative controls. And those are policies, procedures. The employer might have a written program on infectious disease and who administers that. And it might say, try to keep 6 foot a distance. I would say 6 foot and more. But between people. And then there's the lunchrooms of how do you handle this? Can we stagger lunch breaks? Can we stagger shifts? Things like this, administrative controls. And then frequent cleaning and disinfecting of like lunchrooms and things of this nature. And then obviously hand washing and how to properly put on and remove personal protective equipment. One thing I would say is, if you think about personal protective equipment, there's some training, administrative controls that comes with that. So if you're the person who's doing cleaning and disinfecting in your workplace and they give you some gloves, it's not one size fits all, and it's not one glove is good for all chemicals. And I'll use the analogy of like my daughter's balloon. If I take her, at a carnival, she gets a latex balloon full of helium, and she gets one of the balloons that looks like it's made of aluminum foil, by the time that day goes on, you'll notice that the aluminum foil looking balloon it's looking good, it's still full, and then the latex balloon is actually, fell to the floor because on a molecular level, the helium has passed through the material. So think about chemicals in your gloves, about how it passes through on a molecular level. And that's an important part right now when everybody is cleaning and disinfecting. So make sure that people have the right equipment, training, and then that takes us to personal protective equipment. As we had mentioned earlier in the call, that puts you directly in front of the hazard or dealing with a hazard, and that's the only barrier between you and the hazard. While it's generally seen as a least effective control, it is an essential control regarding protection from the virus. And that can be such thing as the good thing that's come out of this pandemic is now all of a sudden people understand what an N95 filtering face piece respirator is. That's important that people start to understand the use and limitations of respirators. And sadly, our government has done a poor job of using the Defense Production Act, and we're hoping that will change in the coming administration to make sure that healthcare workers have N95s and have the protection that they need, because we still have a lot of healthcare workers, that includes steelworker members, who don't have the personal protective equipment that they need. And so I would add that what is not personal protective equipment is the control device, the homemade facial coverings that people use. They are a source control. They are not considered personal protective equipment. And using those means wearing it correctly. That means over the nose and the mouth. But all of this is your tools in your toolbox, and you should use them and use them all wisely. So that's what we need to do as a union.
Well, Steve, you mentioned using the proper equipment, and you mentioned ventilation. So are there specific things to look for when discussing ventilation issues with the company?
Sure, there certainly is. And let me start with some low-hanging fruit. And, now ventilation has become more important than ever. And, especially in places such as like your guys' workplace, they're hot. And most people went into a break room just to cool down and deal with the problems that exist in the workplace to either warm up or cool down depending upon the season. And there's some things that you're going to want to look at. All too often, these things don't get proper PM. And what I mean by PM is preventative, periodic, and preventative maintenance. All too often, what I hear about the PM of some of the ventilation systems is it's post-mortem. It shouldn't run till failure, or it just does. It runs, but really the belt is loose on the fan and the drive motor, or it could be running in reverse. So there's a number of things that needs to happen from a predictive, preventive, and periodic maintenance standpoint, and that also includes inspection. When was the last time that the filter was changed, and how clean, dirty is the system? And we see a lot of these systems that are really plugged up, not properly maintained. We've also seen employers now who are trying to contract out our work. And when our members serviced and maintained this piece of equipment, it was always up to snuff. And now we're paying for a service of some outside entity who is collecting their $200 and going past go in the game of Monopoly. And all of these systems that we used to have for our health and safety have really just been neglected, but yet the employers are still paying for a service that we're not getting. And so, it's important to get these things back, that our people have the ability to monitor this equipment, take care of it, be trained and educated on how it's supposed to work. But I'd also add some other things when it comes to this issue of ventilation. I've been in workplaces where, we were dealing with dust, and people will use pedestal fans or desk fans, and they'll try to blow a hazard or a particulate away from them. Although that's well intended, that's not the answer. A pedestal fan, those kinds of things are not for particulate, they're for cooling workers. The same thing for dealing with a virus. We need a HVAC system to deal with that. We don't want to have pedestal fans just simply blowing a virus to someone else, because what if someone is sick or they're asymptomatic and they're shedding the virus but don't know it? So how does ventilation flow inside the workplace? And if that ventilation system is recirculating air, that can be issues as well. How well is it filtered? How does it disperse? There's a number of things. And what's really important right now is, I've been into a lot of plants, and I always remember going to my plant when I started there, and if you went into the north end door by the cement room during the wintertime, you better make sure you got a good hold of that door, because it's going to be hard to pull it open. And then you better make sure it doesn't get closed too fast on you, because there was so much negative ventilation in our plant that the door would literally slam behind you. And so it's important now, as we head into these cold winter months, that we need outdoor air coming in to help the negative pull, as well as bring in clean, fresh air that helps those ventilation systems. So outside air is really important to have that's clean. Indoors, potentially hazardous. So, and that kind of depends on how it filters back. So maximizing the provisions of outside air, and this is a challenge because we're all going to want to be warm, and we all have different comfort levels. Some people, might want it to be really warm, and others are like, man, you're killing me, and, this person's wearing a hoodie. So there's going to be some different temperature ranges, but if we can kind of be mindful of this whole outside air and how important it is to maximize that, and the number of air exchanges in a room or building is really important. Those are things that I would be looking at, as well as just trying to think of things, how can we eliminate or minimize the recirculation of some of that air that could possibly be contaminated. And we think about that in terms of a permit-required confined space. You don't want the tailpipe of a truck running right there where you have a ventilation going tube down, trying to ventilate a duct where it's pulling outside air. So when you think about that, if we're going to be pulling outside air into a break room, how do we get clean, fresh air, and that we're not introducing, other hazards back into a room? And then the filters is something that you're going to want to look at. There's what's called a MERV rating, and a lot of people are trying to use what's a MERV 13 or greater. Because that's what ASHRAE has looked in and said, this is what we would like to see people using. But this can be no good deed going unpunished. If you put too much of a strong filter in a system, it would be like trying to suck a milkshake through a straw. Then all of a sudden you can't get anything, and we're not doing any kind of air movement. So there has to be some hazard identification, some risk assessment, analysis of the equipment, and what can we do and what can we not do.
Okay. No, I appreciate that. We've been talking a lot about that lately. We also talked a little bit, you mentioned masks and N95 masks. So not all of us are fitted for an N95, nor do all of us have the access to the N95. So a lot of us are wearing cloth masks right now. So do you have any tips how we need to be wearing them, keep them, and wash them so that we're keeping ourselves and others safe?
Sure. Well, let me first say I think it's good that people have them and that they use them. That's what's most important. And then for people who would use them, and I'm just saying that with the control devices, the cloth facial coverings, if you're working in an area, let's say, for instance, you're a welder, you certainly don't want to have fabric on your body that is not rated for the types of exposure that you're involved in. So we do know of some workplaces who recognize that hazard early on in the pandemic, and now people have the same material that the welder uses as his welding jacket, the same type of cloth material to use as a cloth facial covering. And there's many vendors that sell those out there. And then, the care, maintenance, and use of them is somewhat on the user, unless you're in a workplace where, you're dealing with a highly hazardous substance. And then the question would be, should we be wearing some type of recognized and what I'll call approved being by the National Institute of Occupational Safety and Health, as a respirator? And if NIOSH has given it approval, then that means it is actually a respirator. And if people are going to use a respirator, you also don't want to have to try to have people pull air through a filtering, actually what's termed as a respirator under NIOSH, which is why OSHA, the Occupational Safety and Health Administration, says if people are going to use a respirator, the employer has to provide training. There's got to be fit testing, fit checking to make sure that you've got a proper seal, just like our hands. We're all different sizes. Our faces are different sizes. So if people are going to use a respirator, they got to be fit tested. They got to be fit checked every time you go to use it to make sure that you got a good seal. And the other part is this whole availability. And as much as we as steelworkers would like to see everybody, including the general public, having the best that money could buy, unfortunately the N95s are not readily available for the public, and they're not readily available for healthcare workers when they should be. And so we've been saying, where we've got healthcare workers, let's get them taken care of for those people who are on the front lines. But we also have to be mindful. We have workers who, prior to the pandemic, are dealing with particulate that's in the air or hazards that does need to be, first of all, captured by the hierarchy of controls. And where those controls aren't enough, then those people should also be in respirators. And I would also suggest that when it comes to wearing masks or respirators, that there's a risk assessment done where if people can't do the physical distancing, so for instance, you got two maintenance people and they're installing an electric motor, to operate a conveyor, and they got to be right there in each other's breathing zones. That's something we got to figure out. Can we find ways to make this so that people aren't in those breathing zones? If they do have to be in one of those breathing zones, how can we eliminate that exposure? How can we reduce the distances that people, or increase the distances that people have? And if they've got to be that close to one another, do they need an N95? And how long will they be exposed to one another? And do people have symptoms? And if you do, don't come to work. And how do we make a safety net for those people? We've seen employers stepping up and doing the right thing, where not only if they can fall under the CARES Act, depending upon how the rule applies to them, and if it doesn't, we've got employers who are setting a best example where they say, no one will suffer loss of pay or benefits or a hit on the absenteeism program, because an N95 is only 95% effective. So even though if you put a mask on somebody, a facial covering, or if you put an N95 on them, that doesn't mean you're bulletproof. It means it's effective up to 95% to capture things so it doesn't end up in your breathing zone. So we got to be mindful that facial coverings, respirators are not the end-all, cure-all. There's still leakage that comes with those.
No, I think that's a great answer. And I think something we've been dealing with lately, and I know you've talked a little bit about it on some of our conference calls, the term COVID fatigue is being thrown around a lot. And I know we see it both in our community and in our workplace. Do you have any advice on how to avoid it or how to help others avoid falling victim to it?
It's reality. Let's just kind of look at it. We're human beings. We knew what life was like before the pandemic. It's also become politicized, sadly, but it's real. And if we don't believe that this is not real, and I understand, I would love to, being from Iowa, I'd like to get back to Indianola, where my family is, just south of Des Moines, Iowa, and see them for the holidays. But we know that if we're going to protect, we call her Granny, if we're going to protect Grandma, then right now this year is 2020 is just going to be different. We're going to get on Facebook. We're going to get on whatever we've got to do and use some technology. But if we give up and we're fatigued and we just say, you know what, it's Christmas, I'm going to drop my guard and let's go back to Indianola, Iowa, and let's celebrate the holidays and one another. The last thing that I would want to do is live with the fact that, boy, I stopped on the Pennsylvania Turnpike and I must have been exposed to somebody on my way to Iowa. And even though I might have been tested, that was good for that moment in time. But then while I'm there for the holidays, lo and behold, I end up exposing a family member who would be at high risk. and given the age, and that person would end up in the hospital on a ventilator and no one around them, and their last words was, "Tell my family that I love them." I personally don't think I could live with that, and I recognize that we are social beings. We're human beings. We are social. So maybe, some of the terminology that we use about saying social distancing, I think we should be saying, why don't we physical distance? Let's just physical distance. We should be social. We need solidarity in our union, and let's keep it going. But all we have to do is really think about, if you look at the news of what happened when we had pandemic fatigue. Just look what happened over Thanksgiving. That's a pretty good telltale sign. Every time we've been around a holiday, those kinds of things, we see the numbers going up. And, this isn't the flu. We're fortunate to have a vaccine for the flu. And, people are less sick. But this is something that we don't have a vaccine for. And this is killing a lot of people. And, I would just say that if you look at this, the vaccine won't eliminate the virus. We're still going to have, even though some people will get the vaccine, as our frontline healthcare workers will get, and that's still an issue. Some people feel like, I don't know if I trust the vaccine. There's a lot of issues that we still got to work through on this and understand. But this is about saving lives, saving your own health, and your family.
Hey, Steve, this is Roy. Hey, one thing we've been talking a lot about COVID, but the one thing I've always, I guess, since I've been along or coming along in the union, or like my first safety conference, I was amazed at how much stuff the steelworkers did in trying to push for standards to help protect workers or its members in various workplaces. Could you take a minute, if you got time, to kind of go over some of those accomplishments our unions had? I mean, something like the Silica standard, and I apologize. I remember, I know there's something named after you, I believe, that you worked on with OSHA, but I can't recall exactly what it is. Could you highlight some of that?
Sure. The Steelworkers Health and Safety Department's been a very progressive union, and let me go back to, a lot of employers have what's called life safety programs, and I'll give you two examples. Lockout, tagout, or the control of hazardous energy, the permit required confined space standard. Sadly, it takes a lot of lives being taken or stolen by people going to the workplace to provide an honest day's work for an honest day's pay. They signed a job application to give work, not their life or their limb, and then they ended up losing their life. And the steelworkers have been very progressive, and in fact, we've had to sue OSHA under different, administrations, predominantly even under administrations who you would have thought would have been friendly to labor. But in the end, it was, if we've got hazards, they need to be dealt with. And so we've sued OSHA, for instance, the permit required confined space standard, to get a standard, because would-be rescuers were more fatally injured than the people who was originally in the space. And so that's some examples. And as you mentioned, there's health standards. The Silica is one of them, and then beryllium. There's been a number of healthcare standards that unions have fought for, and with the AFL-CIO in Washington, D.C., where we have affiliates of one big union, and that's been a lot of horsepower as well. So there is a lot that our department does that people would not see. So I appreciate you mentioning that. I will also say that this is where elections have consequences. Under the Obama administration, there's this what's called the Salmon Letter, I think that you was referring to. And the Salmon Letter is, I wrote to OSHA and said, look, we got some problems. We are an employee representative. We're there to help our members in the event that they need us at their workplace. And I showed up to accompany a compliance officer on the inspection, the OSHA inspection. And at that point, I was denied by the employer. They wouldn't let me in. OSHA tried to get me in. They didn't get me in, but we didn't want to hold up the inspection because there had been a fire and one of our members was exposed. And so at that point, we just stepped back and we said, look, go do what you got to do. The local union will accompany the compliance officer. And then we sent this letter in. And then ultimately, we got this letter back, a letter of interpretation. It's a letter of interpretation. It's not a regulation, but it interprets the law and the regulation. And it said that basically the situation that I had does allow, under the law, to have a union representative to accompany the compliance officer, whether you're an employee or not, because you are the authorized employee representative. And that was issued under the Obama administration. And if you just did a Google search for the Salmon letter, you'll get a lot of hits on it. And then when the Republicans took control and President Trump, they rescinded that letter. So quickly how we had it and then how quickly it was gone. But the good news is that the regulation, the OSH Act, is still there. But this is where we try to get things clarified. And when we come, we share a lot of experience. Unfortunately, I've been with you guys at your local in the good and the bad times, and even throughout the company's good and bad times when, workers have had their lives stolen from them or their limb. And, it's about learning and improving and finding out what failed. It's not about what somebody did or didn't do. And let's all learn from this. And if we can get people working together to find out those failures and fix those systems, it should never come to an OSHA inspection where you have to use the Salmon letter to be able to accompany a compliance officer. If the systems are working right, then we shouldn't have to worry about OSHA. But if OSHA does come, they're a tool in the toolbox. But in the end, all of those systems should be working where we don't have to worry about OSHA because they're the minimum wage, and we believe in making better than minimum. And that's why if you look at the contract language that you have in your contract, it's much better than just the OSHA requirements. And I highlighted earlier about the master language. And, I remember the first time I stopped there at your guys' hall using the green card. Use your contract language in addition to what is out there, whether it's letters of interpretation, regulations. It's all part of the tools in your toolbox.
Yeah, and that's what I've been thinking while I was listening to you. Is, you and I worked a lot with our safety language, and people we want to depend on OSHA or government agencies, and sometimes they're not there for you when you need them, and that's why your contract language is so critical.
Oh, indeed, Brad. And I would just say this, I ask people, if you think OSHA is the end-all, cure-all, politics has a play on it. It's not kept up with the times. There's different chemicals. Those things haven't been revised. And I would just encourage people to think of OSHA as minimum wage. It's the minimum requirements. Nobody, when we went into our workplaces, said, I want to work for minimum wage. In fact, I voted for a union to say I wanted more than minimum wage. I want a living, saving wage, and I want to have good benefits that when I retire, I can hear, I have my lungs, I have all these things in place. So, yes, OSHA is a tool, but it does not stand for our Savior has arrived.
Yep. Well, Steve, as always, thank you for standing up for worker safety, and thanks for being on the show with us today. Is there anything else that you would like our members and their families to know in order to help keep them safe this holiday season?
Sure. Just, on a workplace note is solidarity. The more that we're together around health and safety and we work together, then the stronger our union is, and the stronger the union, the safer, the healthier our workplace is. And just make sure that we're together. And there's going to be times when we disagree. I get that. I understand that. But I can tell you, after bad things happen, whether someone's life was stolen or their limb, we all come together. And let's not do it retroactively. Let's do it proactively. And we all seen what happened over Thanksgiving with the cases. So let's make sure that we're taking care of one another. We've got the control devices on our faces. We wear them properly. Let's keep our physical distancing, but still be social with one another to keep solidarity up. And then use your risk mitigation strategies. Stay home. Enjoy those that you love in your household and your family, and show the steelworker members and healthcare and all the other healthcare workers that we support them by doing our part. And I just say thanks to all of you on the phone as part of the podcast, but also to the members for for being strong and making sure that we got good safety and health language, and that's what was in the contract, and you stood up for that. So I can't thank everybody in the steelworkers, from the officers of the local to the membership, for all you do, and be safe.
All right, Steve. Well, thank you, and hope you have a happy holiday season.
Thanks. Take care, brothers,
See ya.
sisters.
Yep. Bye.
Thanks, Steve.
Bye-bye.
Thanks, Steve.
Hello, listeners, and welcome back. This segment's brought to you by Mike's Recipe Corner. Take it away, Mike.
Well, today, I believe we have 2 recipes to indulge our listeners in.
Yes, we do. This first one I saw, and just by looking at it, I was like, oh, man, does that look good. It's a chocolate chip cookie dough dip.
When you dip, I dip, we dip.
And by gosh, it's as good as it looks.
I would agree with you, Roy. It is excellent.
Mike,
Yes, Roy.
what's your recipe?
So my recipe is a decadent Oreo salad. I'm sure you will love it as you are eating it.
Damn, that's good.
You said Oreo salad?
Yes, it has little bits of Oreo in it. You can taste them for hours, Roy.
Brad likes salads.
Then I'm sure you would love this Oreo salad.
Where did you get the recipe from, Mike?
The recipe was given to me by a good friend that we all know.
Is it a friend you share recipes with?
We share recipes daily.
That's a good friend.
Yes, it is, Roy. Yes, it is.
And if that little fella wants to stop by the hall after work, I'll have some chocolate chip cookie dough dip waiting for him.
Because when you dip, I dip, we dip.
Yes, but there will be no Oreo salad left because Brad will have eaten it.
If it said salad on the end, he wouldn't want any anyway.
I know, and you will have eaten it all.
But if it would have been Oreo donut, that might have helped.
You are correct, Brad.
I'm just saying.
All right, back after that delightful, decadent
Decadent.
Mike's recipe.
segment of Mike's Recipe Corner. Hope you guys enjoyed our try at Saturday Night Live with the expense at our brother. Mike, you brought up earlier that missing off our list, but has been brought up to you at leadership is Tito's Vodka.
Yeah, Tito's Vodka. They at least make the bottle. So
So yeah, our steelworkers make the bottle of Tito's, and let's see, Sean,
Hello, Roy.
where can people find us?
On our Facebook page, Apple Podcast, Podcast Addict for Android, iHeartRadio app, Spotify app, Radio.com app, Libsyn.com, the locals website, and Men's Restroom here at Local 105 on Douglas Glen Road. Stop by for some dip.
When you dip, I dip, we dip.
It's pretty good, though.
That's what somebody says.
Yes.
Our next podcast will be next year, so want to wish everybody, all the membership, a happy and safe and happy holidays. Going through this, everybody's has a different. Our holidays certainly look different. Doing the segment, reminds me of what we have for our traditions. My wife's family, Christmas Eve. It's usually like pizza, wings, queso. You have sugar cookies. You frost them for Santa and whatever. Been doing that for years with the kids, and usually get together, and then you have your meal on Christmas and you get together, and that will not happen for various reasons in my household this year. But it's going to be hard on everybody. Make it a little bit easier by keeping yourselves safe and your brothers and sisters safe out there on the floor.
Yep, and I'd like to thank Steve Solomon for educating us on everything he did for us today. And I'd like to wish you guys a happy holidays, except for Brad.
And again, thanks for everybody for their generous donations to the Christmas baskets.
Yep.
And our Connie helped with that too, so we were able to do the 600, and we will wrap that up with handing out those baskets on Friday, December 18th. So thanks again.
Yep, thank you.
Thank you.
Do you have anything else, Sean?
No, you guys did a good job. Thank you.
Say something good about your union.
Every day.
Every day. Till next year. Thanks, guys.
See you guys.
Steel Revolution is a production of Steelworkers 105, Bettendorf, Iowa.